Culture came from the Latin word cultura, stemming from word colere, which means to cultivate. An understanding of culture requires an understanding not only of ethnicity, race, rituals, and language, but also differences in knowledge, perceptions, beliefs, and attitudes. What is context and level of analysis? For example, I have here two pictures. The first picture is a man with women. If you are male and you need to answer the question, who am I? Sitting in a room full of women, the answer is most likely, I am a man. Because of the situation, of the event, because of the context. Or for example, you're a Filipino, attended a white party, and someone asks you, who are you? Maybe after giving your first name, you might say that you're a Filipino because based on the context, you're with different races, specifically white man. You might say that I am a Filipino, I am an Asian. Most of the time, we perceive ourselves based on our environment or based on what situations we are at the moment. But it is not always the case. Even though the context can influence how we think, it does not mean it changes our self-views. And this is where the level of analysis is important. This means that our views of ourselves reside at different levels of conscious awareness. Our level of analysis about ourselves would give us a deeper understanding of ourselves. And same with culture. Culture is not just about race, traditions, beliefs. It is wide, it is deep, and diverse. Think about these two pictures. Like someone in the army or someone on an athletic team, both of them have their own cultures. This means that the culture in which we live influences ideas about what to do, what to wear, how to behave, and even how to feel. Maybe all of us will agree that all realms of human endeavor hang in webs of cultural norms and expectations, including health. The influence of culture on health is vast. It affects perceptions of health, illness and death, beliefs about causes of disease, what are the approaches to health promotion, how illness and pain are experienced and expressed, or where patients seek help, and the types of treatment patients prefer. Let's review some of the key figures and medical events in the world history and their different approach in health with regards to their culture. I will discuss the following as the key figures and medical events in the world history. The following are Western medicine, traditional Chinese medicine, American Indian, American Mexican, and of course, in the Philippine setting. Let's start with the Western medicine. The Western medicine focuses more on science and research than tradition and rituals. Let's start with Hippocrates. Hippocrates is considered to be the father of modern medicine because in his books, he described in a scientific manner many diseases and their treatment after detailed observation. Hippocrates established the basics of clinical medicine as it is practiced even today. He even introduced numerous medical terms universally used by physicians, including symptoma, diagnosis, therapy, trauma, and sepsis. Hippocrates is credited with being the first person to believe that diseases were caused naturally and not because of superstition and gods and goddesses. How about Galen? Galen viewed the body as consisting of three connected systems. And what are those systems? First is the brain and the nerves, which are responsible for sensation and thought. The heart and arteries, which are responsible for life-giving energy. And the liver and veins, which are responsible for nutrition and growth. Galen was the first physician to use the pulse as a sign of illness. And one of his most important demonstrations was that the arteries carry blood, not air, as had been thought for 400 years. Let's now proceed with Avicenna. Avicenna is a Persian polymath who is regarded as one of the most significant physicians, astronomers, philosophers, and writers of the Islamic Golden Age. And he is the father of early modern medicine. He created a system of medicine that today we would call holistic, in which physical and psychological factors, drugs, and diet were combined in treating patients. This holistic system truly applies today worldwide. We have also Leonardo da Vinci. Leonardo's robot and his accurate sketches of the human anatomy inspired scientists today to create a surgical robot. The surgical robot was named after Da Vinci and is used today to perform many surgeries such as heart surgery, prostate surgery, hysterectomies, and joint replacements. Leonardo studied internal organs, being the first to draw the human appendix and the lungs, mesentery, urinary tract, reproductive organs, the muscles of the cervix, and a detailed cross-section of coitus. How about Vesalius? Andreas Vesalius is known as the father of anatomy. He was the first to carry out dissection, to closely observe the inner structure and construction of the human body. Human anatomy was not learned by dissecting dead bodies before Vesalius. That's why he is the father of anatomy. How about Pasteur? During 1800s, Pasteur introduced the concept that vaccination could be applied to any microbial disease, and he is the father of immunology. We should be thankful to Pasteur because we have vaccines now, like for COVID. During the 1900s, in 1928, at St. Mary's Hospital, Alexander Fleming discovered penicillin. This discovery led to the introduction of antibiotics that greatly reduced the number of deaths from infection. That's the contribution of Alexander Fleming. During the 1920s, the cost of medical care rose due to growing demand and higher quality standards for physicians and hospitals, advances in medical technology, licensing criteria, and the growing acceptance of medicine as a science, which led to the emergence of hospitals as credible centers for treatment. And during this time, College of Surgeons was founded in 1913, and it was the first body to accredit hospitals. And up to now, Western medicine is regarded as one of the greatest of all time. While the other side of the world is busy discovering human anatomy, vaccines, antibiotics, the other side already has their own medicine and ways of traditional healing and treatment. And this is the traditional Chinese medicine. This system of medicine is at least 23 centuries old, and it aims to prevent or heal disease by maintaining or restoring yin-yang balance. China has one of the world's oldest medical systems. Traditional Chinese healers seek to restore a dynamic balance between two complementary forces. This is the yin, which is passive, and yang, active. According to traditional Chinese medicine, a person is healthy when harmony exists between these two forces. But illness, on the other hand, results from a breakdown in the equilibrium of yin and yang. And now we have the American Indian. In Native America, wild plants are of fundamental importance in medicine and understandings of the tribal cultures like animal spirit healers. There are 7 contributions of Native American that I'm going to discuss. First is the syringe. In 1853, a Scottish doctor named Alexander Wood was credited for the creation of the first hypodermic syringe. That is basically the model of our modern syringe today. But a much earlier tool existed. Before colonization, indigenous peoples had created a method using a sharpened, hollowed-out bird bone connected to an animal bladder that could hold and inject fluids into the body. So they are using this sharpened hollow-out bird bone as their syringe. These earliest syringes were used to do everything from inject medicine to irrigate wounds. Next is the pain relievers. Native American healers led the way in pain relief. For example, a willow bark, it's a bark of a tree, is widely known to have been ingested as an anti-inflammatory and pain reliever. American Indian also has a contribution in terms of oral birth control. Plant-based practices such as ingesting herbs, dogbane, and stoneweed were used for at least 2 centuries earlier than Western pharmaceuticals to prevent unwanted pregnancy. So they are using dogbane and stoneseed as their oral birth control. And while they are not as effective as current oral contraception, there are studies suggesting that stoneseed in particular has contraceptive properties. How about sunscreen? Native Americans use sunflower oil, wallflower, and sap from aloe plants have all been recorded for the natives in protecting the skin from the sun. There are also noted instances of using animal fat and oils from fish as sunscreen. Okay, number 5. What's this? Baby bottles. Okay. Bottles to aid in feeding infants were already available among American Indian. The invention consisted of the insides of a bear and a bird's quill. So, after cleaning and drying and oiling bear intestines, which in the picture, a hollowed quill would be attached as a teat, allowing food and water to be suckled by infants for nutrition. Okay. Number 6, mouthwash and oral hygiene. Although tribes across the continent use various blunts and methods for cleaning teeth, it is rumored that people on the American continent had more effective dental practices than the Europeans who arrived. In particular areas, mouthwash was known to be made from a plant called gold thread, which is in the picture, to clean out the mouth. It was also used by many native cultures as pain relief for teething infants or a tooth infection by rubbing it directly onto the gums. And lastly, suppositories. Indigenous peoples throughout the Americas created suppositories from dogwood trees. Dogwood is still used today externally for wounds, but hundreds of years ago, small plugs were fashioned by moistening, compressing, and inserting the dogwood to treat hemorrhoids. It's easy to go about our day-to-day lives without thinking about the role that public health and medicine play in keeping us safe and healthy. But it's even easier to take those things for granted without recognizing the brilliant innovations and inventors that got us where we are today. In some instances, we have sanitized, improved upon, and perfected our modern day practices. But in other instances, we are not much further than our ancestors were. Those healers who knew how to use the land and its resources to produce effective methods and substances for ailments. How about American and Mexican curanderismo? The term curanderismo and the term curandero come from the Spanish verb curar, which means to heal. The word curandero could be applied to anyone who claims to have some skill in the healing arts, from a brain surgeon to a grandmother giving medicinal teas. But for Mexican Americans, the title curandero represents a healer who is part of a historically and culturally important system of healthcare. Curanderismo is a diverse folk healing system of Latin America. The Mexican Indians had many gods. They believed that their gods punish sins with illness. Therefore, disease or illness was supernatural in nature. And as a balance, some mortals who were spiritually chosen were given the power to heal the wounded spirit and cure the supernatural illness. And this is the role of the curanderos and curanderas. And now we have the Philippines. The Philippines is an archipelago that is comprised of over 7,000 islands and is home to a diverse population consisting of over 170 ethnic groups speaking several different languages. And naturally, each of these cultures have their perspectives on health and healing practices. Overall, the Filipino culture represents a set of mixed practices that drive from both the indigenous components and the ones borrowed from the Western culture. So in terms of culture and health in the Philippine setting, Filipinos believe in cultural healers who combine the use of herbal treatment and supernatural powers. However, for most Filipinos living in urban areas, the major form of treatment is biomedical. One of the Filipino cultures is being religious, and Filipinos are known to be very religious. One of their beliefs is the Bathala. They believe in God. They believe in Allah. And for Filipinos, it is impossible to secure health without God or Allah or Bathala. Having God or Allah or Bathala in one's life was thought to lead to health and well-being. Similarly, his absence or the absence of God or Allah or Bathala in one's life was believed to cause diseases or ill health. In Christianity, faith healing is exemplified especially in the miraculous cures wrought by Jesus and his apostles. Filipinos believe in faith healing, and they call them faith healers. Faith healing is the practice of prayer and gestures, such as laying on of hands, that are believed by some to elicit divine intervention in spiritual and physical healing, especially in the Christian practice. Believers assert that the healing of disease and disability can be brought about by religious faith through prayer or other rituals that, according to adherents, can stimulate a divine presence and power. How about the albulario, herbolarios, and herb doctors? In our days, we call these native medical practitioners herbolarios, and the name given by the Spaniards. So these albulario or herbolarios are doctors that use herbal plants or herbal medicines. And most of the Filipinos are seeking help from these herbolarios or albulario. How about the mystical or superstitious beliefs? Some of Filipinos or most of Filipinos believe that sleeping with wet hair can cause blindness, or they believe in mangkukulam or witch, and kanto or diwata, and sometimes bangungot, or in English, sudden unexplained nocturnal death syndrome. Mangkukulam is the term used to the people who practice the sorcery. They often do it for revenge or to do evil things to people. Sometimes the counterpart of the mangkukulam are the faith healers, which I have already discussed. It is like a battle between evil and good. Filipinos also believe in encanto and diwata. They greatly resemble to human appearance, except that they have elvish-looking ears, and they are actually good-looking beings that are very powerful. Filipinos believe that you don't sleep when your stomach is full, because according to the superstition, bangungot happens when a person sleeps on a full stomach. Sudden unexplained nocturnal death syndrome has been reported worldwide. SUNDS is endemic in Southeast Asia and is colloquially known as bangungot in the Philippines. I will also discuss some of the coping styles of Filipino which are very relevant to their culture. Filipinos are known to be patient or matyaga. It is the ability to tolerate uncertain situations. They're also flexible or lakas ng loob, being respectful and honest with oneself. Filipinos, one of the best coping styles is humor. The capacity to laugh at oneself in times of diversity. Another is the fatalistic resignation. Filipinos view that illness and suffering are the unavoidable and predestined will of God, in which the patient or family members and even the physician should not interfere. Conceding to the wishes of the collective. It's like pakikisama or to maintain group harmony. So those are the different coping styles of Filipinos which found to be very effective in one of the studies. Okay, looking back to the previous presentations, how do you think culture affects the health paradigm of one society or community? Religion, culture, beliefs, and ethnic customs can influence how patients understand health concepts. Understanding how behaviors are rooted in an individual's unique cultural experience and as a response to social pressures can better equip healers or doctors or whatever we call it with the context, skills, and empathy necessary for holistic care. We have discussed that Western industrialized societies see disease as a result of natural scientific phenomena, and they advocate for medical treatments that combat microorganisms or use of sophisticated technology to diagnose and treat disease. While other societies believe that illness is the result of supernatural phenomena and promote prayer or other spiritual interventions that counter the presumed disfavor of powerful forces. Amidst the differences, culture plays a major role in health. And for the application today, awareness is the first step in achieving cultural competency in our practice. Clinicians need to realize that they also bring their own cultural context to patient relationships, even if they don't realize it. Cultural competence is as important to the outcomes of the patients. Every step of the care process, from getting an accurate medical history to developing a treatment plan, requires trust and a good relationship between the provider and the patient. And that is completely dependent on the cultural competence of the provider.